Today, we're diving into an important and often overlooked cardiac condition, Wellens Syndrome. If you're interested in learning about how subtle ECG changes can indicate a serious heart issue, you're in the right place. Let's get started. What is Wellens Syndrome? Wellens Syndrome is a clinical condition characterized by biphasic or deeply inverted T waves in the V2-3 leads of the ECG. This pattern is highly specific for critical stenosis of the left anterior descending artery, or LAT. The condition typically follows a recent history of chest pain that has now resolved, making it particularly important to recognize. What makes Wellens syndrome unique? The T-wave changes seen in Wellens syndrome are usually present when the patient is pain-free, but they can be obscured during ischemic chest pain episodes. This is due to pseudo-normalization of the T-waves, where they may appear normal despite ongoing cardiac issues. This is why serial ECGs are critical for all patients presenting with chest pain, as Wellens syndrome may not be obvious during the acute phase of chest pain. Clinical significance. Even though patients may be pain-free when the ECG is taken and have normal or minimally elevated cardiac enzymes, they are at extremely high risk for a large anterior wall myocardial infarction within the next few days or weeks. Because of the critical LAD stenosis, these patients often require invasive therapy. Without it, they can suffer MI or even cardiac arrest if subjected to inappropriate stress testing. Diagnostic criteria. To diagnose Wellens syndrome, the ECG should show deeply inverted or biphasic T waves in leads V2-3, sometimes extending to V1-V6, pain-free state during ECG, isoelectric or minimally elevated ST segment less than 1 mm, no precordial Q wave, preserved R wave progression in precordial leads, a recent history of angina, normal or slightly elevated cardiac markers. 2 patterns of T-wave abnormality. Wellens syndrome presents in 2 main patterns of T-wave abnormality. Type A, biphasic T-waves with initial positivity and terminal negativity seen in 25% of cases. Type B, deeply and symmetrically inverted T-waves seen in 75% of cases. Over time, T-wave changes can evolve from type A to type B. Sequence of T-wave changes. What happens over time? Sudden LAD occlusion. A complete blockage of the LAD causes a transient anterior STEMI, often accompanied by chest pain and diaphoresis, but these changes may not be captured on the ECG at first. Reperfusion. If the LAD is reopened, either through spontaneous clot lysis or pre-hospital aspirin, chest pain resolves, ST elevation improves, and the T waves become biphasic or inverted, similar to post-PCI. T-wave evolution. As long as the artery stays open, the T-waves evolve from biphasic to deeply inverted. Reocclusion risk. The LID can reocclude, causing the T-waves to undergo pseudo-normalization from biphasic inverted to upright. This signals hyperacute STEMI and is often accompanied by chest pain recurrence or ECG changes that precede the symptoms. Sequence of T-wave changes. What happens over time? Evolving STEMI. If the artery remains occluded, the patient will develop an anterior STEMI. Stuttering pattern. Alternating ECGs may show patterns of Wellens, pseudo-normalization, and STEMI, reflecting intermittent reperfusion and reocclusion. Location variation. These changes aren't just limited to the anterior leads, they can also occur in the inferior or lateral leads, such as with RCA or circumflex occlusions. Non-thrombus causes. Wellens syndrome can also develop following vasospasm, e.g. cocaine-induced vasospasm, but it's always safer to assume critical LAD stenosis and proceed with an angiogram. Wellens syndrome, type A pattern. In the type A pattern, the hallmark of Wellens syndrome is the presence of biphasic T waves in leads V2-3. Wellens syndrome. In the type B pattern, the T waves are deeply and symmetrically inverted across the anterolateral leads. I hope you found this information helpful. If you did, be sure to like, comment, and subscribe to stay updated on future videos. If you have any questions or want to dive deeper into any of the topics, leave a comment below and I'll get back to you. Thanks for watching and stay tuned for my next video